So many of our healthcare systems and insurance systems have already taken on the Chinese model of how to treat employees. That would explain why healthcare is in the toilet. Yes, if it hasn't come to your hospital, it soon will. Yes, this was in 2022. United Healthcare Group, Illini Health, criticized for digital employee monitoring practices. This is why all the cameras, this is why Northwestern putting in those cameras, they have gotten in these CEOs of these hospitals, the Hospital Association, Nursing Association, Medical Association, got in bed with the communist Chinese model of how to treat employees, which is why healthcare is in the toilet. And this does not work. Micromanaging never works. This is intimidation. There should be criminal penalties against the people that did this. I seriously, I am not trying to be extreme here. I am saying that you do not do this in a free country. If these people want to go move to China and treat their employees that way, then get the hell out. But I think most American citizens would align with me on this one, that all of you people at the American Medical and Nursing Associations and hospital associations and all you hospital CEOs that have done this to your employees for years, and now you bringing in these tactics, I think we're going to demand that criminal charges be placed on you, that investigations be done into how far in were you with the Communist Party. So this article, again, this was 2022. Digital employee productivity monitoring is gaining in popularity across every industry, including at United Health Group and Illini Health. But the practice is coming under fire because of how monitoring can be directly tied to compensation and job security. You know what? These people should be treated like this. So they know what it's like. So they would know what it's like to be intimidated by your chief nursing officer. None of these people should have licenses. This was the New York Times that reported it. A United Health employee told the Times that social workers and therapists had their computer keystrokes monitored to ensure they were staying active. That's straight up out of China. This is absolutely, I know enough about how China treats their workers. This is this is how communists treat their employees. That's why the criminal charges should come against the medical, nursing, and hospital associations. All be investigated. Needs to happen. If keyboard activity stopped, they were marked idle and then derelict, even when they were having in-person conversations with patients or visiting drug treatment facilities. The employees said compensation was affected by keyboard activity, and social workers were ranked on a 1 to 5 scale based on how active they were. This literally killed morale. Yeah, it will. That's the reason there is no morale in nursing. So when the nursing managers and the chief nursing officers want to carry on about why you're not invested, it's because you're treating people like slaves. Don't expect to be in a leadership position, not realize that you're treating your nursing staff like slaves and like animals, and then you expect them to be invested. I found myself really struggling to explain to my team members who were master level clinicians why we were counting their keystrokes. Other United Health employees working in the insurance division reported similar tactics of the company tying compensation to keyboard activity. An Optum spokesperson told the Times the company does monitor employees but did not say how many. We know there is no single measure to fully assess team productivity or individual performance, they said. In August 2020, strict productivity monitoring policies arrived at Illini Health on top of existing policies. Hospice chaplain employees with the Minneapolis-based health system said they were required to write down the estimated productivity points in a spreadsheet every morning, which was then compared to a computer-generated productivity score. Illini employees said this policy led to prioritization of productivity points over patients because job security depended on points. I really, at this point, I think you could just, it's safe to say that the Chinese Communist Party is running healthcare. If you work in a hospital where it hasn't taken over yet, then great. But if this isn't stopped, it'll take over all of them. Chaplin said they rearranged patient visits, how long they visited, and which facilities they visited based on earning points. Quote, do I see the patients who earn the points, or do I see the patients who really need to be seen? An employee told the Times. This is going to sound terrible, but every now and again I would do what I thought of as a spiritual care drive-bys to get points. If a patient was asleep, I could just talk to the nurse and say, do they have any concerns? It counted as a visit because I laid eyes on them. See, this is part of the problem too, okay? When they cut staff years ago and nobody held these CEOs accountable criminally, because see, right away they should have been held accountable criminally. If you are not going to provide the safest environment for staff and patients, then you clearly are somebody that should be investigated. Maybe you're just incompetent, but we don't just keep these people in place. Now they're in every hospital. They don't give a shit. There's no I am sorry to say this, I really am. I have not come across a hospital CEO in this country that cares about anything except the bottom line. If they do, they're hiding. And they hide because they know they only care about the fact that they got in bed with communist tactics. So it's either the Communist Party is running healthcare. That's clearly obvious. Because when you cut staff, this is why nurses end up having to cut corners. Because it's impossible to get it done. It's impossible. So for years, this is what nurses have to do. Because it comes down to trying to keep your job. This is no way. All of the corporate world is out of their mind. They're certifiably insane. But of course they would be. They're with the World Economic Forum. They align with the sociopaths. Alina's director of hospice told the Times the company was extremely proud of the high quality and compassionate hospice care its team provided. Yeah, so they're lying on data, but would that surprise you? Communist parties usually will lie about everything. So they're just lying about the data. Clearly, work morale, everything has tanked because of this kind of system, which naturally it would. There's no positive outcomes with this. This is just hospitals and healthcare systems and insurance wanting to be dictators. Overall, Illini viewed the productivity points as a success because patient satisfaction and employee engagement scores improved. Yeah, but the fact of the matter is they're lying about the engagement scores. They just are. Yeah, because when you don't have a happy team that feels like they're actually helping people, but instead they're just trying to get everything done and they're pulling their hair out because nobody gives a shit. And then you have chief nursing officers that are stupid enough to say stuff like, I could take on 20 patients, all violent psych patients, and I could do this without any techs or any other staff. Then you know you're in real big trouble, because that's a sellout chief nursing officer, one that not only sold out to the corporate world, but basically sold out to the Communist Party. Way to go, healthcare.